Welcome back to part 2 of my video blog, discovering 10 myths about your lady parts that no one either knows or talks about. Now, if you missed part 1 of this video blog, go back and check it out because I give a tremendous amount of information there, and I want to share that with you because the more we know about our lady parts, the more we know about these myths, the more we can become empowered and the more we can sort of go into our healing journey with the most profound knowledge that we can have. And I find that sometimes these misconceptions that we have about our pelvic floors are a detriment to us. So let's get started. We're going to start with the part 2 of this video blog, and I'm going to discuss the first one. And the first one is huge. This one, because I treat a lot of patients, a lot of female patients that suffer from constipation, and many of them think that the reason that they have constipation is because they have digestive issues. Like, okay, sure, that may be true. Okay, but there is another culprit here. And one of the main things that we have to know about our pelvic floor muscles is that in order to urinate or evacuate, we need to be able to let go of them and we need to be able to relax them. And when someone is suffering from constipation or they have pain with defecation, typically these muscles are too tight and they're not releasing enough. So don't think that just because you have constipation that it's just a mere fact of a digestive issues. Your pelvic floor muscles can be heavily involved in your constipation issues. So that's myth 1. Myth 2 is, this is my best one, because a lot of women that I treat, whether they're suffering from incontinence or whether they're suffering from pelvic pressure, or whether they're suffering from frequency because they have to go to the bathroom all the time, they feel that they need to push to get the urine out or to get the feces out. And I'm going to tell you right now, pushing with defecation or urination is probably one of the worst things that we can do. And when patients first come to see me, they're really surprised when I talk to them about this because they're like, what? Well, how are you supposed to get anything out if I can't push? Well, you're supposed to learn how to relax your muscles. You're supposed to have a great good nutrition, which we can discuss that later on in part 3. But the most important thing is pushing with defecation and urination actually makes the muscles tighter. It makes them go into spasm, the pelvic floor muscles. You can develop trigger points. And then you can have this sort of an annoying pain in the pelvis all the time. So I find that a lot of the pelvic floor muscle dysfunction is not just an issue, a medical issue. It is an issue of behavior and changing our everyday behaviors. And I'm going to be discussing that in my webinar that I'm going to invite you to attend, and I'll give you that information at the end. The other one that I love is that my pelvic floor dysfunction or pain is caused by a medical condition. So I get women that come in and they are at the end of their ropes. They have seen everybody. They have been on what I call the Dr. Rose show. And no one is giving them a straight answer. And sometimes, a rose is just a rose. Sometimes things are simple. They're not as complex as we make them out to be. We're not dying from a fatal illness. But what we have is that the pelvic floor muscles are a culprit of many of the symptoms that we feel in our queendom, in our lady parts. And I mean, they run the gamut. You can have sensation like a deep ache in the pelvis, or you can have a burning sensation in the pelvis, or you may have some difficulty inserting a tampon, or even having intimacy without pain. So this myth here that I'm trying to explain is that it's not always a medical condition. Of course, you should check yourself out. I mean, I'm a big believer in that. But know that sometimes the answer is as simple as a dysfunction in your lady parts. So I want you to wrap your head around that because that's really critical, okay, for you to understand that, it can be that simple. And the majority of the women that I treat, it actually is that simple. And you know what's the worst part? They've been on the Dr. Rose show. They've been given medications, they've been given injections, they've been given, things to put inside the rectum or inside the vagina that actually the side effects of those medications are actually worse than the condition they're suffering from. So I want you to understand that sometimes it's just as simple as having an issue in the pelvic floor muscles. So that's a big thing. Myth number 9 that I want to share with you is that sometimes you can have a feeling in the vagina that you have a yeast infection or that you have a UTI. Now, recently I had a patient that went and she traveled, she was on vacation, and she traveled to a far, far place, and she thought she had a yeast infection. Now, it turns out that her tests were negative. She didn't have a yeast infection. What she was actually suffering from was a muscle spasm. A muscle spasm that was so severe in her pelvic area that it drove those symptoms home to her, that she thought she had a UTI because she was itchy and burning. But what she really needed was some simple massages and relaxation exercises, and I'm going to talk about that in my webinar, so I hope that you attend that, because honestly, sometimes we're running to take an antibiotic or we're running to take an over-the-counter medication, and that is not what you need. What you need is to have a profound understanding of what's really going on in your pelvic floor muscles, and to understand that there are lots of myths and misconceptions around this topic. And this is one of the reasons why I'm doing these video blogs, because I want you to know the truth. Because the truth has been held from us, or actually a lot of doctors and midwives and other practitioners are not familiar with the pelvic floor muscles. So they, we can't blame them. They're just not familiar, and so they're doing what they know to do. So that's a big, huge misconception that I want you to understand about yeast and UTIs. My big one is when I get a woman that comes in, and this is number 10, and she's suffering from pelvic floor muscle dysfunction or pelvic pain, and she doesn't think that any of the surgical procedures that she's had are involved in it, because many of these surgical procedures are done above the waist, like on the abdominals, and I'm talking about cesareans, myonectomies, I'm talking about laparoscopic surgeries, and or I'm talking about simple scars, like an appendicitis scar. And what I want you to know is that the abdominal muscles are interconnected very deeply with the pelvic floor muscles. So if the fascia of the abdominal muscles has been disrupted, and it does get disrupted when we have a surgery, then of course you have to be thinking a little bit lower than the scar. So we want to take care of the scars, but we also want to make sure that the pelvic floor muscles, these deep connectors, are communicating with the abdominal muscles in a way that's right. And we want to also know that if we do have a scar, you do need to have some scar therapy, because we want a harmonious relationship between the core and the pelvic floor muscles. And sometimes, and this is another thing, if you're working your core very, very hard and gripping all the time, you're going to develop trigger points in your abdominal area that can be contributing to your pelvic floor muscle dysfunction and pelvic pain. So I want you to really think about these myths that I've just discussed. I think that the more we know, the easier it is going to be for us to be empowered. The more we're going to be able to communicate with our healthcare providers so that we're on the same page as them. And many times we may have to be the ones to bring the conversation up. So that's my gift for you. Also, I'd like to take this moment to invite you to my webinar, which is all about how to take care of your lady parts. So I'm super excited about extending this invitation to you. There's a link in this blog to the webinar, so go to it. I hope to see you there. There's going to be some extraordinary bonuses. Of course, you know I'm big on giving, so I'm going to have a lot of different gifts and bonuses and ebooks, etc. It's going to be really phenomenal, and I hope to see you there. Join me. This is HERRERA from Pelvic Pain Relief, coming to you, shredding the myths, and take care of yourself.